My name is Corey Hammond. I have a master's of public health in my concentration was community health science and practice. I graduated in 2017, and I am currently working at Partnership to End Addiction, which is a research and advocacy organization here in New York City. I am a research associate and a project coordinator on a small research team called the Science and Technology of Early Prevention. My interest in mental health and substance use disorders was sparked in Dr. Goldman's class. It was the epidemiology of global mental health. I remember I did my final paper on the treatment of mental health disorders in the US prison system. And so that led me to taking the winter term class about incarceration health. That sent me to interning with the Fortune Society out in Queens, where I learned all about the intersection of mental health, drug policy, all of these different things. And that kind of all together was integral to me getting my position at Partnership. I'm involved in all parts of the research process. I do everything, and that would be nearly impossible without my MPH. I mean, I use the skills that I learned in grad school every single day. I was considering NYU when I was finishing my bachelor's of public health in New Orleans. I knew that I wanted a broad foundation in all types of public health because I didn't know what I wanted to pursue. And so I think coming to NYU allowed me to learn about the local community health solutions as well as international health. It really just provided me with everything. I've always been interested in working with historically excluded populations in research. Individuals who use substances, especially pregnant people who use substances, face so many societal barriers to wellness. I'm interested in health equity, drug policy, mental health, and my job is kind of a perfect intersection of all of those interests of mine. I would absolutely recommend a degree at NYU GPH. The faculty is just absolutely incredible. They're putting out so much unique, valuable research. The alumni network is incredible. I had the opportunity to delve into so many of my different interests in public health, while at the same time getting the foundational knowledge necessary for me to be in the workforce and be successful in the workforce. The friends that I made at GPH are all just incredible, motivated, passionate people that will be my friends forever. And it just, it was the best decision I ever made coming to NYU. Going to school in New York City allowed me unparalleled opportunities for internships, experiences to really help me hone in on what I wanted to do in public health. I interned at NYU Hospital in the Poison Control Center. I was an assistant 6th grade science teacher through America Reads through NYU. I interned at the Fortune Society, helping people who had just been released from Rikers. I worked at an international NGO, like all of this just while in grad school. Just like the breadth of experiences that I had and the expertise of the people that I was able to learn from, I think is just entirely because I was in New York City.